Hello and welcome back to my channel. If you are preparing for Adult Nursing Competency-Based Test, you're in the right place. In today's video, I'll guide you through essential questions needed to help master your math skill in passing this important exam. Whether you're a nursing student, a professional, or you're just looking to refresh your skills, this video is packed with helpful tips, strategies, and practice questions. Now, this part is a part 3. If you missed the previous ones, do make sure to check them out. Link will either be in the comment section or description. Now back to the video. We'll cover everything from medication dosages conversion, converting units, and interpretation of vital data. By the way, if you need the link to these practice questions to practice for yourself, it will be in the description as well. So grab a pen and paper and let's dive right in. If you're new to our channel, my name is Samuel and we make nursing content on this channel. Helpful tips, day in the life of a nurse, and some other things that I know that you'll find interesting. Don't forget to hit the subscribe button, like, comment, and share to somebody who you know will find this video helpful. Now let's dive right in. So don't forget to read the instructions because it contains every vital thing that you need to know. It contains everything in order to pass this exam, because sometimes it's not just about knowing the right answer but putting it in the right way. As a nursing student or a nurse, you should know that dosages and units mean a lot in nursing. Okay, let's go to the first question. What is the volume that has been drawn up into the syringe? Please use the correct units and write your answers to 1 decimal place. This is very straightforward. We have where the fluid is stopped at 0.8. So we're just going to scroll up and put in 0.8 ml. What is the volume that has been dispensed? Please use the correct unit. This is 15 ml. A patient has been prescribed 0.8 liter of gelofusine. What is the volume in ml? We all know that 1000 milliliter is 1 liter. So 0.8 liters times 1000 gives us what? 800 ml. Isn't that too much though? A patient produced 650 ml of urine in 24 hours. What is the volume in liters? That is 0.65 liters. Please take note that where the units have already been provided for me, I am not putting them in at all. A patient has been prescribed 375 mg of vancomycin. How many capsules should be administered? So we have each capsule to be 125 mg. So we're just going to carry 375 and divide it by 125, which I believe should be 3. Yeah. A patient has been prescribed 15 mg of nitrazepam suspension. What volume should be administered? Please use the correct units. So 2.5 mg is 5 ml, which means that 15 mg will be how many ml? You just sort of do some cross multiplication and arrive at your final answer. So I have done mine and I have arrived at the ml, and I'm just going to put that in right now. A patient has been prescribed 450 mg of ampicillin suspension. What volume should be administered? Please use the correct units. 125 mg equals 5 ml. So how many gives us 450? So again, we just go ahead and do cross multiplications. Now I have done my calculations and I have arrived at 18 ml. Our next question says, a patient has been prescribed erythromycin suspension at a dose of 1.5 mg per kilogram. The patient weighs 100 kilogram. So what you have to do is to multiply 1.5 times 100, and the answer is 150. So how many ml should you give? Since 125 mg equals 5 ml, that means 1 ml equals 25 mg, and we are supposed to give 150 mg. So that means we are given 6 ml. If you don't understand how I came around this, you can just go ahead and do cross multiplication as well. A patient has been prescribed 400 mg of zooclopentazole decanoate. What volume should be drawn up for the injection? Please use the correct units. We have 200 mg in 1 ml and we are to give 400 mg. So that's basically, 2 of it. Yeah, times 2. So we're giving 2 ml. A patient has been prescribed 60 mg of haloperidol decanoate. What volume should be drawn up for the injection? So we are to put our answer in 1 decimal place. And yeah, all you have to do is to just go ahead and divide 60 by 100 in this kind of situation. So when we do that, we should have something like 0.6 ml. Next question says, a patient has been prescribed pethidine hydrochloride at a dose of 0.5 mg per kilogram. The patient weighs 88 kilogram. Now, what volume should be drawn up for the injection? So all you have to do is to multiply 88 kilogram by 0.5, which gives us 44 milligram. Now, we have 50 milligram in 1 ml. So just like the previous question, you just go ahead and divide 44 by 50. So our answer says 0.88 ml, and we have here that you are to give your answer in 2 decimal places. So of course we know that it's 0.88 ml. Are you wondering, like, how am I supposed to give 0.88 ml? Yeah, if it's me, I would probably just draw up to 0.9, not up to 0.9 completely, because when you give, a little bit remains in the syringe anyway. Now we have come to the fluid rate charts. So at what rate should you set up the infusion pump to run? Give your answer to the nearest whole number. We have a fluid volume of 800 to run for 6 hours. So basically what we are going to do is to divide 800 by 6. And that should give us 133.33. And the instruction is to give your answer to the nearest whole number. So our answer is 133 ml per hour. Again, take note of your instruction and take note of your units. At what rate would you set the infusion pump to run? 1000 divided by 5. I don't need to calculate hour, it's 200. 200 ml per hour. So we have another one, 300 ml to run for 3 hours. Again, 100 ml per hour. So some of these questions can be very simple, honestly. Now we have the fluid balance chart. So what you have to do is to calculate your input, calculate your output, and then subtract them. If your input is greater than output, then it is plus. If the output is greater than input, then it is minus, which means that the person actually has lost fluid than gaining fluid. So it's as simple as that. I will just go ahead now and add everything up, and I'll put them here. So I have calculated all inputs to be 750 ml and all outputs to be 680 ml. And then I am now going to subtract them from each other, and my answer is 70 ml. And the input is greater than the output, which means that the person gained fluid. So I'm just going to go ahead and put plus 70 ml. Please take note of the spacing, how I'm spacing it, because this exam is going to be marked by a computer, not a human being that will know that, oh, you just didn't write it well, how the computer is programmed to mark it. I hope that makes sense. So let's go ahead now and see. Yeah, we got everything. So I hope you understood everything, and that is it with this video. If you enjoyed it, please do make sure to like, comment, and subscribe, and check out the clinical questions practice tests as well that I will probably be uploading very soon or already have uploaded. So until next time, bye.